complete panacea for triple LC. That is not true. So you see this patient underwent bypass grafts. That is Lima to LED, SPG to D1. Recurrent meetings, they shifted to ICU after surgery. 1 hour refractory BTBF, and the surgeon was calling, sir, will come and see the patient is refractory. We gave nearly 20 to 30 DC shocks. We were doing CPR, patient is not recovered. I said that we will take to cath lab. This is the previous angiogram. That time, a patient had a classical triple valve. This is all calcified. Then based upon that, we advise the by angiogram. See, I will. 1, 2. So based upon that, and all triple valve disease. So then what we did, immediately the left subcomplex totally uploaded. Intervasal calcified, surgeon is unable to graft it because it's like a cement pipe. So he is unable to graft it. Then he was telling, sir, I struggled for a long time. That vessel is, we cannot graft it, leave it. So that is the vessel which produced the ischemia triggered. Then what we did, it requires a lot of modification. You see the none of the balloon was going, none of the microcatheter. This is the rota. This is called a half rota. Half rota, you have to, if you push it too deep, it can and burr entrapment, burr will not come out. So you have to do the half rota and block modification. Almost 2-3 times we got burr entrapment. So then see the burr stall here. Then subsequently we did initial beneath rota. Then almost we tried for 3 hours this case. Then subsequently the nano everything dilated. Then we established the flow. You can see the nice flow of the L6. Previously it was totally uploaded and patient recovered from post-surgery without any events. So that's the reason post-bypass, immediately any post-operative MI is there, the flow is there, many times we take them to cath lab, we'll do how the graft is patent or not, otherwise whether they put the, ultimately the only one principle, heart has to get the adequate blood. If the blood flow is compromised, patient will not survive. So that is the beauty of the procedure. See, this is bypass, classic case, severe calcified lesions, LED. It was done in one of the reputed hospitals in Hyderabad. See, within 2 years, both grafts got closed. The classical, when we say triple whether this is, suppose if somebody does angioplasty, their claim recurrence rate is very high. Why do you want to do it? But you see the LED totally blocked, entire calcified. We can see the black shadow just indicates severe calcium. When you are seeing the shadows before injecting the contrast, that means severe calcium. It's almost Y shape. You can see the calcium. And you can see here LED calcium, LCX calcium. Then we did the rota. When the calcium LED is closed, this is the LCX vessel was opened with the rota. Then subsequently, see, we are unable to see the LED flow. And then with the microcatheters, we placed the we did the rota burying of the LED and the LCX, and both are now final result I will show you. And see, now this is the final result. See, LCX and LED is flowing very well. We use 2-stent techniques, that is called DK crush. This is in the world percussion techniques. DK crush produces the maximum best result. There are different types of stents, T stent, mini crush, many stents are there. Out of those, this is requires more technique, it requires more time while doing the procedures. So always these patients should be verified with the intravascular ultrasound. So once you do the procedure, in the left vein is very, very crucial. Here the stent, if it is under expanded, the chances for losing the patient on the table are very, very high. The stent you have to get at least 14 square mm, 18 square mm, and the LED you should get at least 8 square mm, and L6 also you should get 7 square mm. So we take the IOS images subsequently that adequately expanded, adequately opposed to the vessel wall or not. That's how we have to decide. This is a doctor from one of my classmates' brother-in-law. Actually, work like sometimes patient may collapse. We may have to work for night. We have been doing almost 3-4 hours standing and doing the procedures in 15 years back. So that all added, and thanks to each and every one for paying attention, extending the support. Thank you.
Thank you very much. Till now you are standing actually, but you require a standing ovation, and it was so interesting. He is not only caring. He's sharing. Editor also. He requires one more
Thank you.
a big applause. Because only few Indian authors, they are popular in all over India. So definitely this requires celebration. So
During COVID, almost I addressed 500 webinars online. I attended more than 600 as chairperson or expert. So throughout India, almost all, other doctors may not be knowing, but any interventional cards in India, if they don't know my name, is not a cardiologist. That's
anyway, so please occupy the chair because the small felicitation by. And I also request Kali Prasad. Sir, let the felicitation go. Sir. We are all in the high risk only, so we will take his number and help. Ravindra Reddy, you can also join. Yeah, the real cardiologist, another cardiologist.
We are also joining because he is my
Apollo.
friend.
Badri, Dr. Badri.
Why is Shane not called?
No.
Come, quick.
nice.
Actually, in this regard, I don't know whether this is the right time. Recently, my brother-in-law, he had a cardiac problem. So his friends who were talking, they were suspecting cardiac. But his wife and all, because once we are not well, it's all depends on whoever is our neighbor at that time. They have to take care. So these friends whom he is talking, so they suspected you are getting sweating, you are not able to talk properly. Let us go to the hospital. So immediately the nearest place is Apollo Hospital. They went to the Badri Narayana and I called Badri and he was about to leave the hospital because most of the golden hour is lost for the documentation. You deposit the money, you deposit this thing, all these things, golden hour is lost in any corporate hospital. But when Dr. Badri has seen, it is an anteretroviral infarct, ECG is not recordable, I don't have any hopes. Please take him to the cath lab. Not even a single rupee paid. Everything is, he has taken the charge. He opened 3 times on the table. He has given the cardiogenic shock. Fortunately, today he is doing well. So, he has saved my brother-in-law. So, paying the advance also. So, after that he paid. Thank you very much. And
Yeah, thank you very much for your brief introduction regarding Badri Narayana and our day's sunlight, Dr. Kasturi Sridhar. Really, these were the things which we do not know. Unless we interacted with him, he has given us all the information. We are proud of him. Thank you very much.
I have one doubt.
please hand over the memento. He is also KMC. Dancing is memento. And I also request Dr. Ashok Reddy, another KMC product.
All KMC products
Vandanam. All the way has come from the. You have a memento also? Please accept a small memento as a token of.
Sir, look at that.
So thank you very much, Dr. Sanjay.
Sir, look at that.
Dr. Kishan, Dr.
Sir, look at-
Kishan, another KMC product.
because of your
Kishan, please accept. And Jagan Mohan Rao sir,
Sir, look at that.
Dr. Jagan Mohan Rao sir. Sir, after Dr. Sudeep, I will call you. Award he is also from the KMC. Dr. B. Dr. T. Srinivas sir, thanks for accepting.
Dayal Singh, is a fond of photos.
अरे ठाकुर नन కూడా తీరా
నువ్వు ఎక్కడ పోతావు?
యా యా memento poor handwriting by somebody yaar. That's what I also confused. Ever smiling. You don't ask him, he always smiles.
रिकॉर्ड में आना ना, रिकॉर्ड करो जी। हमारे प्रेसिडेंट साहब की तो दोनों 1 लाख के नीचे नहीं टच करते हैं, 50,000 टच नहीं करते।
Thank you very much. And
I think we had a good session of IMA meeting, followed by break, followed by good academic session. Nothing but greater than is one of the renowned cardiologist from Sunshine Hospital. Now came Sunshine, Dr. Sridhar Kasturi, a very good lecture. So first I start thanking everyone, dignitaries from president, past president, advisor, present president, IMA branch, and secretary Ravi Garu, and heartfelt thank Dr. Sridhar Kasturi. He made a nice, and he covered maximum complex, as a cardiologist I can say, he covered maximum complex procedures and good outcomes. But one thing I have to say, every case is not a rosy. You may have a storm time in the cath lab. You have to depend upon the CT surgeons. You have to depend upon the colleagues and anesthesists. Group is required. There is one man, and thanks everybody and all you have attended heartfully. And heartful thanks from IMA Airport Branch. Good night. Please honor requested to join for dinner.
we have to thank mainly the Sunshine for sponsoring this. They are the main sponsors, and Dr. Badri Narayan also, he has used his good office from one company, he has given some amount of money. And last but not least, please don't forget the Mercedes bench which is standing outside. They also participated in our conference. While going, at least please see that Mercedes bench. You may get some concessional price. So Mercedes bench is standing outside. So, Sabji, anything?
Everybody should get registered and be a proud member of IMA. Thank you.